Okay, so today we're gonna be talking about the chapter 10 out of your Med-Surg book, the immune and lymphatic system. So I'll go ahead and let you kind of find that in your chapter, and I'm just gonna kind of see if I can adjust this so it'll be a little better for you. Okay, so in this chapter, while you're getting to that, we're going to be talking about the innate, and which is the body's natural immune response. It's kind of what we're born with. We're going to talk about the difference between the innate and the acquired versus you getting a vaccine or you coming in contact with the disease in your body, building up those antibodies to that. We're going to talk about what the immune response looks like when you come in contact with these diseases. We're going to talk about ways to prevent these diseases and ways that indicate that you have either an overactive or an underactive immune response. What's normal? What's abnormal? Related to that, I'm going to talk about what the CDC says regarding immunizations for adults. We won't really delve into those related to children's because you're going to be doing pediatrics this summer as well. So Ms. Belrose will cover that more for you. And then we're going to also talk about, what the nurse's role is basically related to that. Okay, so let's go ahead and get started with that. Okay, the first part of it you'll notice is the anatomy and physiology aspect of it. We are not going to be covering that in the lecture part, but I did place 3 videos for you to watch. And there's like 5 questions related to each video. It's about 30 minutes long, so it's 3 videos, 10 minutes apiece. So just making sure you have those watched and the quiz is completed in its recommended time. Okay, so we're going to skip through that. Okay, and again, so the functions of the immune system and the lymphatic system. Again, we're not going to go into detail related to all of this, but your immune and lymphatic system, it's just basically your white blood cells. Is basically your immune system, and your lymphatic system deals with your tonsils, your adenoids, your thymus, which is there at your breastbone, just kind of like right above your heart. You'll see it kind of sitting in that area. Your bone marrow, your lymph fluids, all those type things all work together to provide you immunity. Okay. And so innate, when we talk about innate responses, and y'all know my computer kind of jumps related to the book. It's something related to it. But your innate, which is your natural immunity, basically deals with your first line of defense. Okay, it's what you're born with. It's that initial response that you have to an infection, but that innate, that first line deals with your skin. So we, as a nurse, what we think about that and why that's important is just ensuring that our skin is healthy, it's moisturized, it's dry. It's not really dry, it's not cracked, because those cracks or open areas increase the risk of us presenting with an infection, or increase our risk for an infection. So basically that's that. Okay. Neonates, which are your infants, are more susceptible to infection just because their immune system has not been fully developed. They have an immature amount of white blood cells, things that can help fight them. Main thing that you really need to know about that is knowing when an infant is presenting with an infection, and generally their first signs, they may be irritable, they may be lethargic, meaning they may not have a lot of energy, and related to that lethargy, they may not feed well, they may not interact with you as much, and it's just going to be the change that you're going to notice. And these sometimes are the symptoms that you see before the fever starts. Okay. And then, so another big thing that we want to talk about is related to the aging, which is as we age, your geriatric patients, a lot of y'all that may choose to work in long-term care, even if you work in primary health, so you're adults, and a lot of times you don't see your younger individuals coming to the primary care physician, but you do see your 40s, 50s, for sure at your 50s, they kind of start making time for those visits. But as we age, you'll start noticing one of the things that we start noticing is just a change in our skin. So especially for your geriatric patients, it becomes thinner, and that increases the risk for injury. So just accidentally bumping up against a door or something like that can cause a break in the skin. That break in the skin, because the body already has a decreased ability to be able to fight infection, increases the risk of infection. You also think of the other things as their kidneys and their lungs, the capacity of those things are decreased. So that increases risk for respiratory type issues, your flu, your pneumonia, your kidneys unable to really filter out this bacteria that we normally are able to kind of get rid of. You think about malnutrition. So your geriatric patients as they age, and we talked about this before in integumentary, they don't eat as much. It has to do with taste buds because they atrophy or shrink. And so they're not getting as much protein in, and we know protein is the building block of the cell. So that's how we create. And so we don't recreate or regenerate those things, then you have decreased ability to be able to fight. You also think about limited mobility as we age. We kind of slow down. And so because of that, decreases circulation. So circulating the lymph nodes, or these white blood cells, through our body, also kind of increase the risk. And the other thing is medications. So certain medications decrease our ability to be able to fight, especially like your anti-inflammatory medications, like your NSAIDs, your Motrin, ibuprofen. That is significant in the sense of when you decrease the inflammatory response, which our body produces an inflammatory response in order to be able to fight an infection. And in our mind, we're only thinking about, okay, it's decreasing the pain, but you have to think about the mechanism in which it decreases the pain. Okay, so that's basically really all you need to know related to that. So it's that chronic disease that you'll generally see with that. Let's see, it's important to kind of keep our immune system healthy, because that kind of helps with balance in our homeostasis. So it keeps us healthy, within be able to function internally and externally with that. So that's basically the primary job of the immune system, is just to protect our body. If our body is protected, then we are healthy. And if we are healthy, then we're able to live these active lives that we want to live. And also, if we continue to protect our body from any injury or infection, then it also decreases the risk of us having certain kinds of illnesses or disease that can cause harm later on in life. Okay. So again, we talk about our first line. We've kind of mentioned this, and you kind of see that, and this is kind of really one of the big factors for a nurse to understand is that our first line of defense is our skin. So protecting that. So we'll kind of repeat that a lot, because it's important for you to understand it, because it's also important for you to tell it to your patients. With that, it also talks about our tears. So it kind of helps with this drainage. It produces, kind of helps wash away this bacteria. You have to think about that. You think about earwax. Earwax is thick and sticky. So it allows for the bacteria to be trapped in this, or in that substance, instead of being invaded into our body. Okay, so we think about those things related to that. Let's see, what else do I want to talk to you about? This means that the body can recognize certain microorganisms as harmful even without prior encounters, immediately lodging in the defense. Just because you're innate, just our innate immunity. What we were born with, our body basically, it's not this adaptive response. I mean, okay, I've seen this before, but it's just what our body does naturally. We sneeze, we cough. It's just our way of getting rid of this bacteria that we have that could potentially cause harm to our body. Okay, no one way that we can tell that as nurses, white blood cell counts. White blood cell counts are elevated, and they tell us that our body's trying to fight an infection. Do you always treat an elevated white blood cell count? No, not necessarily, because sometimes it's just your body saying, okay, I'm doing my job, and that's a good thing. Just as you see a low or decreased white blood cell count, it's a lot of times an indicator that the body is unable to fight an infection like it needs to, and that's something that you want to monitor, or rather the doctor wants to monitor. And so when we look at, we're not diagnosing our blood work, but it's kind of one of those things that we need to know, hey, what we need to put in front of the physician. Sometimes we look at the individual's past lab work. So have they had a steady decline in their white blood cell? And we bringing that attention to the physician. So it's kind of what it means. Okay, when the body has an inflammatory response, so no, again, an inflammatory response is an elevated temperature. You can also have some swelling or your edema related to that. That is just, it's this heat, warmth to it. Again, this is just the body's response or way of fighting the infection. So raising that heat, swelling, or producing this extra fluid is what kind of kills the bacteria. Okay, so understanding that is the immune response, that fever, that swelling, production of tears or secretions kind of helps wash it away. So just understanding that, and you know that that individual is presenting with an infection that comes into play. Like if you have someone that has a cut, how do you know this cut is getting infected? So know that the initial response is it may be red, it may be warm, it may be a little edematous, a little swollen. That's the initial natural response, okay, to that, okay. When it's abnormal, or when you know, hey, okay, something is wrong with this, is when it's past your, say, 24 hours. Because if you know, if you get a cut, your initial cut that you see is going to be red, it's going to be painful. But once you clean it, you put some triple antibiotic ointment on it, or whatever you want to do, just kind of clean it and dry it, and you leave it even open or cover it with a bandage, you notice that that redness or that pain is gone away. That's kind of a good example of you being able to see, okay, I see what that initial response is versus when it's something more serious. So if that it goes away and then it comes back within 2 or 3 days, maybe you forgot to put a Band-Aid on and you went to work and you went outside and you worked in your garden, and then the next day, it's like, oh man, this is sore, it's swollen, ooh, it has a little yellow drainage coming from it. That's your indicator that it's an infection. Okay, let's see. Another big thing that you want to kind of pay our attention to is that inflammatory response, especially when you're looking at swelling or edema. It can lead to tissue or nerve damage. So that's kind of one important thing that you want to treat that. So that swelling is a trauma response to it. So you can get swelling if an individual has a DVT, so a deep vein thrombosis, if they've had a fracture, because that's an injury to that area. So again, it's an immune response. So you have this swelling, this redness, this pain to it. Burns, when anybody has a burn, that area starts to swell, it gets red, it gets drainage, it's very painful. Tight bandages. So you also have to think about sometimes not necessarily just an injury like that, but if you wrap a bandage around an individual too tight and you're cutting off that kind of circulation, that edema that comes from that can also cause some damage. So one way we always do that, especially like patients that have casts or any type of dressing on it, we try to make sure that it's not too tight. We also always, especially the area of the injury, we check pulses. So your pedal pulses, your radial pulses, things like that, just to ensure that there is no injury. You don't want to cause any nerve or tissue damage to that. Even if a catheter or an IV site gets infiltrated and there's redness and there's swelling and there's infection, in that site, we want to pay close attention to that, because then again, like I said, infiltrate. So the chemical or the IV solution that's being infused into the body can cause tissue damage to that area. And like I said, as well as that swelling can cause some nerve damage to that. So we want to make sure that we stop the infusion and we treat it per our facility protocol. So just kind of a way of thinking what this looks like on your patient. You look at table 10.1, major components of the immune system and their function. So basic thing that you want to know with antigen and antibody. So just basically being able to recognize these terms. So that comes into play when you are seeing some test results related to that. So if an individual, so an antigen is the foreign, your body is fighting an infection. So you know that means the individual has an active infection. If you see that individual has built up an antibody, that is a sign that there was a past infection. An antibody is the effects of an antigen. Okay, so if an antigen has went there and is fighting the infection, at the end of the infection, you have an antibody related to that. So that comes into play, and that's important when you're reading certain lab results. You're trying to see if an individual has an active infection, so they actively have hepatitis, or if there is a past infection related to it. Have they built up an antibody to it? So you think about that even with your vaccines. When we had y'all to do vaccines for the nursing program, and some of y'all had to go see if you need to get a titer or not. This is kind of when it comes into play. Okay. Know that your white blood cell counts or your white blood cells are formed in your bone marrow. So that's just something important to know. Just being aware of some of these terms with that. When you see that an individual has low white blood cell counts, or for some reason an abnormally high white blood cell count, and that high means, okay, you're used to seeing, like somebody has a 12, 13, 14, something like that, but then all of a sudden they have a 20, 25, 50,000. These individuals, it's like, wait a minute, this is a lot. Cancer, okay? A lot of times that's what they may be looking at, and they may do a bone marrow biopsy related to that. We talked about where the thymus was located in, but know that that's important, especially if somebody has a chest injury. So some of these things I'm kind of pointing out just so if, some of y'all may want to go work in the hospital, or some of your patients, even when you're sitting in primary care, and they've had a chest injury, and know these individuals may be a little more susceptible to infection just because this area may have been damaged. Okay, but know that the thymus helps with it helps with creation of your immune response. Okay, but know as we age, again, it decreases in size. Thus, it decreases our ability to be able to fight infection. Okay. I just kind of highlighted cells. Again, I say the main thing that you kind of really know about this is when you're looking at a white blood cell count or a CBC. So you're looking at your CBC, and you'll see white blood cell count because that's where you will notice if an individual has an infection or not. And sometimes if they ask for a CBC with differentials, then it will come up with the play of your neutrophils, your basophils, your eosinophils, your monocytes, things like that. That'll be listed on there. You're like, what does that mean? It kind of helps the physician diagnose the patient with that. Understand that certain medications, chronic inflammatory disorders, autoimmune disorders, such as your rheumatoid arthritis, your inflammatory bowel disease, things like that can affect the readings of this. All right. Let's see what else I want to say about that. Even certain medications like your anti-inflammatory medications, Geodon is an antipsychotic medication. Those things can also decrease your immunity with that. Let's see. Eosinophils, okay, is another good one to kind of point out, just because it's also an indicator of like an allergic response to it. So sometimes you'll see that, especially with individuals that have had allergies or just had an allergic response to something, some medication or whatever like that. Your basophils may also be elevated, like in an anaphylaxis. So you can kind of see that. So that kind of helps you there. Memory T cells is kind of, you don't really have to memorize that. Like I think you'll see that in the videos. Basically just kind of helps your body understand that, hey, I've seen this before, let me go and fight it. Kind of helps kill the cells and things like that. Okay, so again, all these you'll see in the video. So you don't have to memorize these, just kind of being familiar with some of the terminology if you see it again. Okay. I kind of highlighted detectable if appropriate assessments are conducted. Basically, it's just kind of a reminder. Assess your patient. Assess your patient for fever. Assess your patient for change. That lethargy that we were talking about earlier. Not eating well. Those type things are all your indicators that an infection may be brewing. All right, so again, antigens, we've kind of been through this a little bit. So your antigens, again, let you know that they're fighting. Basically, your antigens go and fight the infection. It's first line, kind of like, hey, something's going on. They recognize that. kind of along with your lymph at your lymph sites. Okay. I think anything else there I wanted to tell you. Okay, so we're gonna kind of get into like your immune deficiencies. So this is something that you may see a little more of now, especially since COVID. A lot of individuals are having more immune responses, decreased or overactive immune responses kind of vary. You'll also understand or see that some of these autoimmune and autoinflammatory disorders are kind of about the same, and you can have an autoimmune and an autoinflammatory disorder, or one can be an autoimmune disorder with inflammatory responses related to that. So it's not something that you have to per se understand the difference. I'm not going to test you on kind of really knowing the difference of these, but understanding like immune deficiencies. So when somebody has an immune deficient, they are unable to really fight off this infection. With that, a lot of individuals that have HIV, certain medications can decrease your immune system. So say you've had a transplant, an organ transplant, medications, especially steroids, your corticosteroids, prednisone, things like that, can decrease your ability to be able to fight. Steroids, even a lot of people forget, with asthma medications, these things can decrease your ability to fight infections. All cancers, I don't want to say certain cancers and the medications, chemotherapy and radiation, sometimes can decrease your ability to be able to just fight these infections. What does that mean? That basically just means that you may have a cold for 4 weeks. Your pneumonia, your just simple pneumonia, you had flu on Monday, and by Thursday, instead of getting better just like everybody else, you're actually in the hospital because you now have pneumonia. Okay, so that just basically what it means to immune deficient. Your body's just really unable to do its job. You have frequent UTIs because it's unable to fight off the bacteria that's just readily present in our body. Things like that. You just frequently get sick, and it's kind of what we have. You just have more than normal infections. The other thing is you kind of keep coming up with colds. You have a lot of GI issues, so a lot of diarrhea related to that, because a lot of our immune system, we kind of deal with it a lot in our GI tract. We'll learn about that a little later on. With that, a lot of outbreaks of herpes, that is your body's way of saying, hey, my immune system is decreased. And some individuals that have herpes, they'll notice that they have outbreaks generally around stressful situations. Okay. So kind of just being aware of that. And so if you have someone that has herpes, understanding, telling them like, hey, we need to protect your immune system. Protecting your immune system is decreasing the stress. And a lot of times people don't understand that. Stress also comes on the body when you have a cold, because your body is trying to fight this off. So that is in itself a stressor as well. So we tell them still, take care of yourself so you don't have as many colds, so you don't have an increase in herpes outbreaks, okay, or flares. Okay, these individuals may have a lot of pneumonia, a lot of severe sinus infections, and you say, okay, well, what is a lot? Generally, in the medical community, it is said that if you have 2 or more, and I pull this off of the CDC website or INH website, whichever one, I did not cite it, so it's a fault. But it's generally when you have 2 or more of these infections in a year. So normally you don't see someone that has pneumonia a lot in a year. You may get pneumonia every year. Okay, yours is a little weaker than everybody else because you don't know a lot of people that get pneumonia every year. Somebody that has asthma. So again, that's respiratory issues. So, in our respiratory tract, we have these cilia that kind of help pushing everything out. That's what causes us to cough and sneeze. So thus, if you have someone that has asthma, then theirs is already kind of defected in a sense, and they're already taking the steroids, so it's decreasing their immune system, and so thus they have a lot of upper respiratory infections as well. Okay, so kind of keeping that in mind. Another thing people kind of forget that is an indicator that you're immune deficient is thrush or yeast. So an overgrowth of yeast or thrush. You'll see that a lot of times also with AIDS patients, but individuals that have a weakened immune system can have that as well. And kind of the last indicator that I just kind of mentioned is you'll know that an individual has a weakened immune system or they're immune deficient is the antibiotics don't work. So the physician orders them, say amoxicillin or something like that, and they're giving it to them, and they take it for the recommended 14 days or 10 days or whatever, and it just doesn't get better, or it only gets mildly better. You don't see the intended response related to that, and that's what we talk about when we're talking about evaluation. So nurses are evaluating that. So if you see that the patient is just really not getting better, then it's telling you they're going to need longer treatment or stronger medications or antibiotics to help fight those infections. Let's see. Another thing is kind of looking at autoimmune disease. So understanding that an autoimmune disease basically is the body's immune system mistakenly attacking healthy tissue. Okay. And it's just basically what it is. It's just kind of attacking his body. So you'll see that that's common diagnoses that you'll see that are autoimmune diseases or lupus, type 1 diabetes. And you're like, wait a minute, I thought there was the pancreas, but the pancreas just doesn't work. It doesn't create or produce insulin, but they generally see that as the body attacking itself. Rheumatoid arthritis, attacking your tissue, muscle, bone. IBD, so it's attacking the lining of your GI tract. Causing ulcers and things like that. MS, so basically it attacks the myelin sheath, which are the covering of your nerves. That's why they have all these issues. And psoriasis is attacking your skin. Okay, so just understanding that those are really like your autoimmune. Then we get into autoinflammatory disorders. So kind of way to kind of tell the difference between those is your autoimmune is attacking yourself. Your autoinflammatory can still attack itself, but it's more of an inflammatory response related to that. So say like with IBD, you don't always see really edema related to that, or you don't always have a fever related to that. An autoinflammatory disease, you generally have, because it's a chronic inflammatory response to that. So it's fever, it's a lot of joint pain, there's a lot of abdominal pain related to that. You can have a lot of skin inflammatory response, or even eyes. You can have swelling, redness, blurred vision, all those type things related to that. And some examples of those are familiar Mediterranean or FMF, periodic fevers. Like, what is periodic fever? So basically they just continue to have a fever, but there's no other indicators that there's an infection going on. It's just a fever. There's no coughing, there's no sneezing, there's no burning with urination, there's no ear infections or pain or discomfort. Like, there's nothing there. Now the key with that, sometimes you may also see these inflammatory responses. So when you look at this individual, you may see that, like, okay, their throat appears to be red, or you may see like, oh, their ear appears to be red. So naturally with their throat being red, you're thinking, oh, they have strep throat there. Well, the thing with this is when you swab it, and you're waiting for the results to say, oh, they have strep, it's not there. So sometimes this is missed because the doctors say, well, okay, I know what it is, because they have this high fever and they have this red throat, and so maybe they're able to swallow, maybe they're not able to swallow, or it doesn't fit, because sometimes they can still swallow, and it's like, but I know you're sick, so you have to have this, and it doesn't fit. It is an inflammatory response. Okay, same way, the ears are red, and you're thinking like, oh, this baby has an ear infection. But they don't, because they're not pulling at the ear, or they're not complaining of any pain or discomfort. The ear is just red. That is an inflammatory response. So that's what these disorders can have. And I just it's not a lot really, so you don't have to really memorize these, but just knowing the difference between them in this basic sense. So they can have sores in the mouth. Know that's an inflammatory response, okay? And these sores in the mouth, so what would the nurse do about that? What do you think about with your nursing intervention? So keeping the mouth clean, so preventing infection. You think about the food that you eat. You don't want to eat any hot, spicy food. So the food is going to be bland. It's going to be liquid, because you don't want to get any food pocketed in these areas. So that's why mouth care is going to be really important. With that, so even thinking about these things, I want you not as much focus on the symptoms, I guess, but really focus, okay, if I see these things, what is going to be my role as the nurse for them? Even think about inflammation in the eyes. You know, they complain about pain or discomfort. Is it constant tearing or watery eyes, constant blurred vision, things like that, that these individuals have? And think about the quality of life that can be decreased from that. All right. So you also think about immune response, what can produce an antigen. An antigen, again, is your immune response to your body's indication that it's fighting an infection. So know that your pollen, your dust, things like that can create antigens or create an immune response. Certain foods, so that's when you have an allergy to the food, so then you're going to have this antigens produced from that because your body's saying like, hey, wait a minute. Also from medication, so this is also from your allergic reactions. They're all from the same mechanism related to that. Okay, a humoral response just refers to any fluid or semi-fluid, so it just produces these extra mucus, and it's just a way of its ability to be able to help get rid of the bacteria. Okay. Let's see. So your IgA, IgD, IgE, IgG, and IgM. So we'll kind of look more at the table 10.2. So here at this table 10.2, it's kind of really the only thing you need to worry about with this, and this doesn't really come into play. You just kind of need to be familiar with some of these things. So again, like recognizing them. So even if you do have a question related to on your NCLEX and it mentions anything about IgG or IgA, then you automatically can think about this as an immune response. So it's the question asking me, is the individual having been an inadequate immune response, or if it's an overactive immune response. So that's why you kind of want to know just a little bit of like, I know if I see this, it's dealing with the immune response to that. No, IgG is basically crosses the placenta to provide immunity for the newborn. Again, that is kind of helping because remember the newborn's immune system is weakened. So being able to have that increased immune system or additives is vital to their health. With that, and we already know that they have weakened immune system. So the nurse's role with that is ensure that the mother understands that and ways to prevent the individual from having infection. So we talk about if the mother is sick, the father is sick, anyone in the home is sick, making sure they stay away from the baby. If that is impossible for them to do because maybe they are the main caregiver for the baby, so we talk about doing the best you can to keep yourselves healthy, decreasing people from visitors, basically the word I'm looking for, decreasing visitors, making sure your surfaces are wiped down, hand washing, covering your mouth when you cough, or wearing a mask. So even if you're a mom and you're the only caregiver, or dad and you're the only caregiver for the baby, and if you're sick, then knowing, you tell them, hey, put on a mask, because that's it. Even put on some gloves. Make sure you do proper hand washing. Those things help prevent an infection with your baby, just because they're unable to do that. They're unable to fight it like you and I can. Let's see. There was going to be something else that I wanted to tell you. In this. It doesn't come up, but the other thing is I do want you to also kind of keep in mind, I think it's IgA. So IgA is also transmitted through the breast milk, and so it helps, it's one of the main things that kind of helps the baby and its mucosal lining. That's what I'm trying to get through with the mucosal lining. And so the importance with that is that it ensures that the baby is able to fight off respiratory infections and GI infections, just because they would not be able to a lot of times handle it just like you and I would. So it's airway, and then it's also things that they ingest. Okay. So no, that's kind of one of them. The only things that kind of passes that blood-borne barrier there. So just kind of being aware of that. Like I said, you kind of look at a couple of these. IgE, you'll see that because it deals with allergic reactions or allergies. Okay, so that's just something you can kind of be familiar with as well. And the air has come on, so I hope y'all can still hear me really well. All right, let's see if I want to go over this. All right. So just kind of the only thing you really need to know about the autoimmunity is just basically it just kind of comes into play when an individual has had a transplant of any type of tissue, whether it's a cornea related to your eyes, whether it's a skin graft, whether it's a heart transplant, a kidney transplant, anything like that. Those tissues must match, because if they don't, then your body may reject them. Your body may see that, like, hey, this organ is foreign, and it creates antibodies to it, or antigens, to try to fight against that. So they have to take medication, lifelong medications, especially for your kidney transplants, things like that, your heart transplants, just to make sure your body doesn't recognize it as foreign and doesn't reject it. Okay, and also with those steroids that a lot of times that they have to take, or anti-rejection medications that can also decrease their immune system, or ability to be able to fight infections. So especially during cold and flu season, we talk about making sure that they get their vaccinations with them. We talk about hand washing. We talk about putting signs outside their doors and saying, okay, if you're sick, do not come and visit me, please. Things like that. We talk about ways that they can prevent illnesses, so keeping their body healthy. And we'll talk about that a little more later on in the chapter. So when we talk about innate immunity, again, we just talked about that earlier. That's just what you were born with. That is the initial. It is not anything specific. It's not saying, okay, I'm going to attack this certain area. It's just the body's response to, hey, this infection, your fever. And your innate immunity kind of like starts with your skin, that just first line barrier. To prevent infection. Okay, so just understand that acquired immunity is either you've come in contact with it and you have active production of the antibodies, or through immunization. So you got your vaccine, okay, and you've produced immunity to that. Let's see. Naturally immune to a certain disease just means we don't get diseases from animals. There are a few things that can be crossed from back and forth between humans and animals, but we don't have to discuss those right now. So just understand that just as you being a human, that you are naturally immune. Understanding that certain races, genders are more prone to certain diseases. Okay. So when we look at acquired immunity, a person can either actively produce their own antibodies or passively get them from another person, whatever, an animal, through vaccines. Okay. So passive natural immunity is transmitted from mother to baby. So we've kind of already talked about that, and that's kind of like through the breastfeeding, and that's where your IgA. So I kind of already mentioned that to you. So your IgA, again, is the mucosal lining that comes into play with your GI tract, your respiratory tract, kind of helping prevent infections, or decreasing bacteria from being able to enter these areas, or if they enter them in, to be able to kind of stick to those organs that can be flushed out. Okay, let's see, what else I want to say. Depressed immune functions in mother can limit the benefits to the baby. So if the mother does not care for her body, and so that's where nurses are really big on prevention. So we talk about even women that are at childbearing age, and if you're having the conversation and they're thinking about, I may want to have a baby, then we talk about ways to improve the health and immunity of your body. So stopping smoking, stop drinking, make sure you're adequately hydrated, activity level is up, decreasing the stress on your body. Things like that, maintaining a healthy weight will also kind of help with that healthy diet. So when we talk about decreased processed foods, so we talk about fast foods. No, eat a lot of fast foods. Think about your fresh fruits and vegetables. You're baking your meats. You do need your protein, because remember, proteins are your building blocks of your cells. So if you don't have a lot of protein in your diet, then your cells are unable to regenerate itself. Okay. So just understanding that depressed immune system in mom. So that's another reason why they take a lot of their prenatal vitamins. So understanding the importance of that, and even after you give birth, especially if mom is breastfeeding, because again, you're still passing on that immunity to the baby. And so talking to her about, maintaining this healthy body. So watching what she puts into her body to ensure her baby gets the best benefit. Okay. So then we're going to kind of go down to tetanus. Vaccines is right above think critically. So looking at that, so tetanus, basically it causes severe muscle stiffness, spasms like that. You can get, and so you generally get like the Tdap, so tetanus, diphtheria vaccine, and then you have your booster vaccines, which is your TTs, your tetanus toxoid, is what you can get. And y'all, my computer is like it wants to jump. I don't know what happens with that. But anyway, so you also want to know that if you get tetanus, then there's no cure for tetanus. So just kind of keeping that in mind with that. When do you give tetanus? You generally give tetanus toxoid after a traumatic injury, a deep wound, a dirty wound, anything like that. You want to give that to prevent tetanus, like I said, because we said that's just basically it causes severe muscle spasms and stiffness. Having tetanus there's no cure, and then having tetanus in the past does not make you immune to getting tetanus again. So know that you can. So you still must give the tetanus toxoid vaccine. Okay. So it doesn't cure anything, but it still kind of helps prevent future things from that. But you have to get the vaccine. All right. Let's see. Active naturally acquired immunity just basically means that you've gotten a disease, So you've gotten a disease and you've got chickenpox or herpes. So you've gotten those things, and you won't get herpes. You won't get chickenpox again. You may get shingles, but you won't get chickenpox again. When you think about actively artificially acquired immunity, it's when you get your vaccines or your immunizations from it. So vaccine is actually the shot. The immunization is just you following the schedule for your vaccines and what they tell you to do related to that. So they're interchangeable with that. So just kind of understanding know that there are live vaccines and there are weakened, attenuated, or killed bacteria that is injected into your body. And your antigens, your body then produces an immune response to this, but on a weakened level, it produces an immune response to this, and it actually kind of goes and it fights your antigens, and it creates the antibodies related to that. All right, so then those antibodies then are able to recognize if they ever come in contact with it. So especially like with the flu, then you'll get a weakened version of the flu, or it shouldn't be as bad. Basically, that's where you see that measles, mumps, chickenpox are kind of some things. Polio, once you get polio vaccine, then you are not going to get polio. Okay, and then you have hepatitis A and B virus, so example of immunizing agents used to produce an active immunity response in humans. And let's see, what do I want to do? Sometimes you need a booster dose, so a booster of like your tetanus and your hepatitis vaccine. So understanding it and being aware of the schedule related to that. Influenza, so you're going to get that every year. Your tetanus, you're going to get that every 10 years, or if you've come in contact with you step on a rusty nail, then if you're not really for sure when you got your last tetanus shot, they may go ahead and give it to you, even though it may have been 5 years ago. If you're just not sure, sometimes they'll still maybe go ahead and give that to you. All right. Iatrogenic conditions, basically it's just an adverse reaction. It's just something caused by a medical treatment. So that's when you have an adverse reaction to a medication, you have complications from surgery, you have an infection or nosocomial infection, which is an infection caused by the hospital setting. It could also be related to an error in diagnosis that causes a negative response. So they give you a diagnosis of cancer and you don't have it, and you've taken, this chemo drug, or they tell you that you have some diagnosis and they give you a medication that shuts down your kidneys or your liver, because those things can happen. And it's kind of like really more the things you kind of look for. They give you a diagnosis, put you on this medication, and it causes more harm to you, and then you don't even really have it. With the older care points, so just kind of remember with that suppression of this of your immune system by certain medications or even by these intragenic episodes decrease your body's ability to be able to fight off infections. So then we get to the older adult care point. So just understanding the decreased immune response, the decreased function of the body, the chronic conditions, medications they take, the lack of mobility, so that immobility that they have, all those things increase their risk for or decrease their ability to be able to fight off infection, meaning they're more susceptible to infections, and then it may take them longer to get over an infection. So just kind of being aware of that, and it kind of goes in with patient education. So that's why we also kind of really big on our geriatric patients. Hey, let's take your flu shot. It's getting close to time. It's time for your pneumonia vaccine. Making sure you're hand washing, avoiding large crowds. If you have a wound, let's kind of monitor that. Let's kind of keep it clean and dry. Let's keep it covered up. We teach them to monitor for signs and symptoms of worsening infection. We teach them what are the beginning stages of an illness. Are they getting really tired? Has their appetite decreased? Are they coughing more than normal? Pain or discomfort with urination. We talk about increasing your fluid intake if it's not contraindicated to the individual. Decreasing sodas. Also your geriatrics, because they live sometimes in close quarters, so their living conditions are sometimes not as best because of their vision. So sometimes they may eat things that they're not aware of. They have increased falls, which again their skin is already thin. So all these things kind of play into how these individuals are at increased risk for infection, and so how we need to monitor that. The book also talks about these long-term care facilities. You're in close proximity to others, so it's easy to share germs, just like your children at elementary school. So if you kind of notice that they kind of get sick all the time, every time you turn around with that. So for children, you kind of have to keep in mind sometimes it's not necessarily a bad thing, because that helps develop or build their immune system. So we always say a conversation you have with your physician, but understanding that sometimes that is important, because you also see some children that have siblings. Their immune system is a little stronger than those individuals that they're the only child. And sometimes that puts them at increased risk for other diseases like Epstein-Barr. And they generally say that's just because the body, I won't say it's not as strong, but the just body hadn't been in contact with a certain viruses and bacteria that they can learn to fight off. Like when we let our children go outside and play and eat the dirt and lick the walls and things like that, and we're like, oh my gosh. But it's also building their immune system as well. Not telling you got to let your kid do all these things, but understand that you just don't have to freak out. We've already talked about how alcohol can decrease the body's ability to be able to fight an infection. So it just kind of slows the immune response. Cocaine, marijuana, methamphetamines, all those things, again, can do the same thing. It decreases that. Nutrition, your liver function, your kidney function, when you have issues with all those things. And it's just, we talk about these things just for the nurse to understand, and just for you to understand. If I'm caring for these patients, I need to be extra careful. I need to be mindful that I can't increase their risk for infection. So these are some things that I need to do. I need to make sure I wear my gloves. I need to make sure I put on my mask. I need to be diligent about assessing them to be aware of the first sign that there is an infection going on, so we can treat it, because I know that the infection may be a little worse on them, or maybe a little more difficult to fight especially if I wait until it gets to its latter stages. So kind of keep that in mind. That's a lot of times while we're discussing some of these things. It's kind of to help you get the understanding of what individuals are at risk, what it would look like, and your role as the nurse in preventing these things, recognizing these signs and symptoms, and initiating treatment. So notifying your physician, cleaning the wound as soon as possible, not delaying cleaning a wound or wound care treatment, not delaying giving antibiotics and things like that. Okay. Let's see. Another big thing for a nurse is kind of preventing, so your health promotion. So making sure you eat right, and we talk about eating right. So what is eating right? Making sure that you decrease your processed foods, your ultra processed foods. So the eating out at restaurants, and even when you go out to restaurants, we talk about look at some healthy choices that you can eat. So ensuring that you get some vegetables with that, ensuring that you do your comfort foods in moderation, and ensuring that you hydrate yourself, ensuring that when you're not feeling well, don't really do alcohol. And I know there are toddies that they do with your whiskeys and things like that. But overall, we're talking about how to prevent, making sure you stay active. And so when we talk about active, like what is active, making sure you get 120, 150 minutes of exercise a week, so, doing some exercise, 20, 30 minutes a day. And what does exercise mean? It can mean walking, it can mean dancing, just any type of active, consistent movement that increases your heart rate is considered an activity. Ensuring that you get at least 6 to 8 hours of sleep, especially for an adult. So that's a good indicator. So if you're getting more than say 8 hours of sleep, so if you notice that, like, I normally sleep 8, but wow, I'm starting to sleep 10 hours a day, or I'm sleeping up to 11 hours a day, and that's an indicator that something is wrong. So if the body is fighting infection, or the body's immune system kind of weakened a little bit, but knowing if you're not getting enough sleep, it weakens the body's immune system. So if you're working, you're only getting 4 hours of sleep, and then you wonder, like, wow, why do I keep getting a cold, or why do I keep getting this headache, or why does my nose continue to run, and all these things like that. Understanding it's your body's immune system being weaker. Okay. Let's see. The book also kind of wants to remind you that you want to treat all those individuals that have substance abuse as if they were immune compromised until you know differently. All right, so we're also going to go to when we're up on the immunizations. With that, the book kind of talks to you about the CDC. Let's see. I'm going to pull up the CDC guidelines, and that's what I basically want you to do as well. So kind of look at what the CDC guidelines recommend related to vaccines. Again, we're only going to be talking about the adults because you'll go over peds and peds with that. So, and I'm just going to kind of mention a couple of these. Influenza, we know that we give it annually for that. The other thing to know with that is an individual that is immune compromised, we don't generally give them the nasal spray. They actually have to give the vaccine. The other thing is you're not going to give anyone that's immune compromised an actual live virus. Okay, so they get the weakened version of it. They need to get it, but they get the weakened version of it. RSV, that's given seasonal, related to pregnancy. I think it's generally through September to January. Those are generally your months for your respiratory infections. The seasons are changing, okay? So it's going from that hot to cold. So kind of being aware of that. Tetanus, we've already kind of talked about it. You'll get... it talks about getting a dose during every pregnancy. So if you have 3 children, you get 3 doses. So it says it during every pregnancy. These things are left up to your physician, but you just kind of being aware of these things, and then you're going to get your Tdap, so your first dose of Tdap, and then you'll get it every 10 years with that. Measles, mumps, and rubella, generally get that as a child, but you notice that we had you to do your checking your immune response related to that when you got into the program. Varicella, so your children will get your varicella injection. You have the HPV that they're giving now, I think up until, he initially said like to 13, but you can actually get it a little later than that, 27 to 45 years of age. So just kind of being aware, pneumococcal looking at that. You generally give it, especially geriatrics, every 5 years. Children can get it, especially if they're immune compromised or have a lot of respiratory issues. They will get the pneumo vaccine as well. Hepatitis A and B, so for your nurses, your medical health care professionals. So keeping that in mind. But anyway, so you can kind of look at that and get better idea related to that. And so that's basically what we're going to talk about with that. So nursing implications. So, I'm really big related to that. So what is your nursing role? So it talks about a goal of healthy people that deals with WHO. And they talk about one thing they want to make sure is the public is adequately educated on immunizations and infectious diseases, ways to reduce it, eliminate or maintain cases of vaccine preventable diseases. So your hand washing, recognizing these, preventing it. So your PPEs, decreasing alcohol, decreasing drug use, making sure your environment is safe. So that includes even your water, because drinking unsanitary water can also cause a lot of illnesses or decreases in your immune system. Issues with that. So it kind of means a lot of things to you. It goes to the soil, and because that's how your foods are planted and your animals, and it entails a lot of things, but just really for the nurse understanding that immunity and preventing immunity is everything around us, okay? And everything around us can have play a role in whether we are immune competent or immune deficient, okay? Let's see. So we talk about making sure that we educate the public on getting their vaccines. Make sure we know when to get your vaccines. And I'm really big on at least knowing where. Like, it is okay for you to say, I'm not for sure, but I know where to find it. And you go find that. But there's some things that you need to know. Like, I need to know that you get your flu vaccine once a year and your pneumo vaccine, every 5 years. I need to know that your Tdap is your tetanus. So some things, like, just as a nurse, just needs to be able to say off the top of her head. But once you get on the CDC website and you look at the immunizations, it has a lot of factors that kind of play into that. And those things, like I said, it's okay to say, let me find out, or let me pull it up. A lot of places now you have access to the internet while you're in the patient's room, and you can pull it up, and just being able to read that. So that's why I asked you to kind of look over it, so you can read it, so you can be able to interpret that and explain it to the patient. And if you're reading open and you're unable to interpret it, come and ask me. I don't know. We're going to find out together, okay? And so that's what's important. That's one thing that you really need to know as a nurse. Okay. Let's see. We also, you'll see under the box where it talks about legal and ethical consideration, have a lot highlighted there. So basically, kind of sum this up. The nurse's role is not to judge anybody. It's not for us to force our own ideologies on anybody. It's to support the patient. But it's also to educate them on why. We don't use scare tactics. We don't say, okay, if you don't get your baby the tetanus injection, and they can get this horrible muscle disease, where it causes muscle spasms, and and it's going to be very painful and stiffness, and they can't do anything. No, we're not. We just basically kind of give the facts that once they step on the glass, there's the bacteria that can come from these dirty needles or this glass or dirty wound. And this bacteria can affect your muscle and can cause muscle spasms and muscle stiffness that has been known to be really painful and increased risk of death, related to that. So we just kind of talk about that with them. And then we know somebody that is really truly against it. We talk about preventing that. So keeping areas clean and dry, recognizing signs and symptoms. That's the other thing is that if they don't want to do these vaccines, we need to talk about recognizing when you need to seek urgent care. So if they've stepped on a glass or they've been in an accident and they've had an injury, like, hey, this is when we need to recognize that. And then also when we learn with tetanus vaccines, you can give it at the moment, like after the fact, that they like, oh, I want it, now, and yes, it can't go back and, cure any beginning muscle stiffness, but it can prevent sometimes worsening of the situation or any further issues related to that. Okay, so let's see, healthcare workers, we need to get our influenza vaccine. If you're a healthcare worker that is against that, you understand that, hey, I'm against that, and know that certain facilities may have stipulations related to that. And it's because you are caring for the patient at their weakest moment. And we don't want our ideologies to affect our patient's health. Okay, and so we need to be okay with that. Wear a mask. So your facility may say, okay, then you can't either work on certain floors, or you have to wear a mask through this whole season, just to make sure if you're sick, if you're running a fever, things like that, don't come to work. Which are all things that we shouldn't do anyway. But just understanding that these are not invasions of your privacy, but it's really about protecting the patient, because we're seeing them in their most vulnerable state. Okay. Another big thing with vaccines is asking about allergies. Okay, because understand that your patient can have allergic reactions to these. So asking them, hey, are you allergic to any vaccines? Have you had an allergic reaction to a vaccine before? Tell me about the last time you've gotten your vaccine. How did your body respond to that? So that's going to be a very, very important thing that we want to talk to our patients and ask them about before we give this vaccine. Once we give this vaccine, we also want to keep them in the office 15-20 minutes, whatever your facility policies are, and then also educate our patients and give them that information packet from the CDC that tells you, like, hey, if you still have a reaction to this, this is who we reported to. These are signs and symptoms that may indicate that you're having a reaction to it. Understand that the first 24 hours you may have a little low grade temperature. And that is okay. But any shortness of breath, any rash that you may have, any tightness of your chest, fever skyrocketing, anything like that, then you may be having a reaction to it, and you need to seek urgent care. All right. Some individuals, yes, and they may talk to you about herd immunity, and it's just thought that if the majority of the population gets vaccinated for a certain disease, like the measles, then you should not get it. And that's why sometimes you'll see it being affected more, certain diseases being affected in certain populations than others. Related to that, again, we don't judge. We just talk to the patient about the risk factors and let them know that we're here if they have any questions or concerns. Know that there are certain times when you should not give a vaccine, and if you're unsure, always you're going to be able to say, like, hey, when should I? Know when to research it on your own and say, hey, is it okay to give this vaccine? Open up the insert pack, because on the inside of that vaccine, it gives you all the information related to that. Of course, your patient is not going to want you to sit up and read this information, and they're waiting on you 10 minutes to get their vaccines. So some of the things you kind of need to be familiar with, but understanding just basic rule 101, if they are already sick, if they have a fever, if they have cancer, a certain type of chemotherapy, drugs, sometimes these individuals may not get a vaccine. And for sure, again, I've already mentioned, not the live vaccines. So you want to make sure that it's okay for them to get it. Let's see. Pregnancy kind of is a big thing, so you're not going to give any live vaccines related to pregnancy. But they do need their influenzas. Let's see, BCG. So you will see that sometime with your older adults, they have gotten the BCG vaccine, which is a vaccine for TB or tuberculosis, but it's not routinely given here. So some of those individuals may always test positive when you're doing the TB skin test. So just kind of being aware of that. Understand that certain religious preferences may not want to get certain vaccines for certain reasons, like your Christian Science, your Amish, your Muslims, your Buddhists. Those individuals may not want to get the vaccine just because of the products that they're made out of, human blood, so your blood, your pork, bovine, which is the milk that comes from the cow the first days after giving birth. With that, so especially if your individual has an allergy to cow's milk, they may not be able to get certain vaccines. So just kind of being aware of that and certain preservatives in that. So this is why you want to kind of ask those questions, and you want to ask about allergies and stuff like that. Know that immunizations are kind of one thing that is most often associated with anaphylaxis, just as the book says. So what the nurse needs to be aware of that. Okay, number one, yes, I'm aware that this vaccine can increase the risk of anaphylaxis. So what am I going to do about that? So as a nurse, I need to be prepared for that. That's a number one with any anaphylaxis, whether it's to food or medication, anything like that. The EpiPen is one of the main medications that we give that it can go through your clothes, and you give into that that outer aspect of your thigh. You just kind of jab it through there. Okay. You always want to assess the airways, so any tickling. So knowing what those signs are, so any tickling of the throat, or any coughing, or any funny feeling that they may have with that, understanding that, okay, there's possibly going to be an issue related to that. Contacting 911, because you're going to always want to follow your facility's policies related to that. Whether do you need to sit the patient upright, or do they need to position on a position that aids with breathing? So will that kind of help? Do you need to lay them on their side if they're unconscious? Because you don't want to prevent them from. You want to try to prevent them from aspirating. Okay, so those are kind of the main things that you want to do. Always assessing their vital signs. So know that a nurse's responsibility is we're assessing those vital signs, because those vital signs give us an indication that there's a change in that individual, whether it's related to blood pressure decreasing, heart rate being elevated, things like that. Let's see, what do I want to give you? If they've had an allergic reaction to the vaccine before, that vaccine must not be given. So you always want to make sure you let the physician know that. It's not one of those, okay, go ahead and give it to you. Let's see if you have an reaction again. No. So just kind of being aware of that. Let's see, just kind of being aware of HIV, as well as HIV and AIDS, or aware of genetic disorders that can lack or have low levels of infection. So they're just unable to fight infections as well. So when you give them these vaccines, especially like you don't want to give them, especially your live vaccines, so just kind of being aware of that before you give them a vaccine, and ensuring that it is appropriate for them to have that. Let's see, botulism, you kind of get it from improper canning or honey, certain foods, and it's kind of really important to be aware of that, especially for your infants, especially younger than 1. So that's what we talk about, not giving them honey or giving them canned foods, kind of being careful with the foods that we introduce to them, just because it can cause harm to them. But let's see. Trying to see what else, because I've already kind of mentioned this. Once you give your vaccines, I think I've already said that you want to make sure they stay in the room 15 to 20 minutes, just so you're going to monitor for that. And with the botulism, that's something that you want to test. Make sure the individual doesn't have an allergy before you give it. You sometimes see that with some Botox. Things like that, or vaccines that may have that in there. You want to just make sure that they're not allergic to that. Again, the books kind of keeps talking about, we're talking about interventions, but we also want to kind of keep in mind ways to keep the body healthy, like how we're going to ensure that this individual doesn't get sick, or if they get sick, they get the weakened version of the illness. Okay, it's not as severe. Okay, which gives their body the ability to be able to fight it. So eating that balanced meal, healthy fruits, vegetables, protein. So if somebody doesn't want meat, you want to make sure they do, like eggs or things like that. You know, certain G2 feedings may have extra protein in it, IV fluids, things like that. Have that. I kind of highlighted the garlic assists with immune response, only just as a reminder. You don't have to memorize this, but just only as a reminder to ask your patients about any herbal supplements that they take, because they sometimes forget that those herbal supplements can cause interactions with them, specifically like they talk about garlic, and how it can extend the reaction, so increase risk of bleeding, of the blood from clotting. All right, so we'll go down to nursing management. So when we're looking at the immune system, it's functioning normally but not activated. So basically, what you're looking at, your body may not recognize cancer. Thus, if it doesn't recognize that your body has cancer, then it doesn't give the body to the ability to be able to go and fight this. Okay, so when it also is not functioning properly. So if your body is unable to go and fight this, then you have this overproduction or this overimmune response related to that, which causes the cancer to either spread or get worse, the infection to last longer or get worse with that. Okay, so that's kind of one of the things we got to kind of pay attention to, especially if someone has a weakened immune system, or the immune system is not functioning as proper. They're just not unable to recognize and then be able to fight it off. So you could have a wound. Your body's just not able to recognize that this wound is infected. So it doesn't fight it off, or it takes longer for it to heal. It takes longer for the wound to heal. It takes longer for you to get rid of a cold. It takes longer for you to get over the flu. Okay, so kind of keeping that in mind with that. Also important to understand that, remember, your fever, your redness, your swelling, all those are natural inflammatory responses or immune responses. But understanding when they're abnormal, so when the fever gets really high, so you're 102, you're 103, generally at 101, that's when the doctor will kind of start treating with some prophylactic, so some Tylenol or something like that, or your pharmacological measures. The doctor may start treating you with, again, we had already talked about swelling, so the importance of monitoring for that and treating that, because it can cause tissue and nerve damage. So when we talk about exudate, so we think about back when we were in integumentary, and so you think about those drainage colors. So you can have your normal serous sanguineous drainage, which is that clear, the red, bloody drainage. But when it gets to be thick yellow, that purulent drainage, so thick yellow or green, and it has an order in it, that's an indication that the body has an infection that's getting rid, that is really serious. Okay, so being aware of that, knowing our body normally carries like E. coli on that. So we talk about how to keep our skin clean. It's kind of one of the reasons why even when you go into surgery, they tell you, number one, to bathe in some dial soap because it's antibacterial, and then they also kind of clean your body really well, or the area really well, before they do it, because they understand that our body's natural response can increase risk for that. When the nurse is doing data collection, when the nurses are seeing patients in general, and they're asking them questions because they're trying to assess their immune system. So understanding why you're asking these questions. When was the last time you had a vaccine? Are you up to date on your vaccination statuses? So that also kind of gives the nurse an indicator of, no, I don't take vaccines. Okay, I know what type of education I can give you, or I can expect possibly, if you're not eating healthy, you're not getting enough sleep, you drink alcohol, that you could be at increased risk for certain types of infections. I'm going to ask you, okay, if you tell me no, that you don't believe in vaccines, when was the last time you've had an infection? How long do they generally last? With that, do you have any allergies to any food, any medication, anything like that? What about chronic illnesses and some things you can do? You're going to already see in the chart, but just being aware of these chronic illnesses that they mention here are these individuals that require a little extra attention, a little extra education. We need to monitor those individuals for infection and for possibly an infection to last longer. And with interventions, resting, increasing fluid intake, taking your vitamins, taking your vaccines, things like that, especially during certain times of the year. We talk about diet. We talk about monitoring for weight. So these are also some things we tell them, like, okay, hey, so this is what I want you to do. Even when they come in and we're assessing them, we're making sure that their weight hadn't changed. If they come in with an infection, let me double check and see when the last time you came in here with an infection, because the patient may have forgotten, but you can see those things. And encouraging them and talking to them the importance about making sure they see the physician regularly. We talk about herbal supplements. Talk about allergies related to those. So you want to know, do you take any over-the-counter medications? And sometimes we specifically say, what about any herbal substances like ginkgo biloba or any garlic or whatever like that? Because elderberry. So being able to specifically say those things kind of may help trigger the individual. Like, oh yeah, I take such and such. Okay, so being aware of that. And we asked about sexual history with it, because then we know this if this individual is at increased risk for HIV or AIDS, because those things weaken the immune system. If they're on drugs, we know these things weaken the immune system. If they smoke, if they work in a factory around unclean water or gas or certain fertilizers, these chemicals and things like that, that again can increase their risk for certain types of diseases, cancers, again also weakening their immune system. They can affect their kidneys, because we forget these things that we breathe in. Our lungs breathe out the CO2, our kidneys flush it through, our spleen, our liver all filter the blood. So if it gets into our body, onto these bloods, and if our kidneys and spleen are not working function properly, it can't get rid of or filter these bacteria. Okay, so that's also one of the reasons why we talk about, even when a person has had an accident and they've had trauma to these areas, you have to understand that their body's not able to fight it off, because the mechanism that was initially used to get rid of bacteria filtering through their spleen, your liver, your kidneys. If it's defective and unable to do that, then this bacteria has the potential to be running rampant in our body, or has the potential to be able to, I won't say overgrow, but run a rampant and cause worsening issues at a time that I don't need it. Understanding if someone has catheters, IVs, so your tubing, your G tubes, things like that, those things are leave openings in our body, which increases the risk for infection. So if somebody has a catheter, following facility protocol, know when to make sure you change this. Only use catheters if necessary. They have the Purwick now, so you don't have to always use a catheter, because that trauma of inserting the catheter can increase somebody's risk of infection, especially if their immune system is already weak. Making sure that you always assess your IV sites, looking to see if there's any redness, any drainage, any warmth to those sites. And as soon as you recognize that there's an issue there, take it out so you can start treatment as soon as possible. Keeping these areas clean and drying, wearing your gloves, putting your mask on so you're sputum, because we've already talked about how your antigens and things like that, or bacteria is carried through your saliva and your spit, your saliva, your tears, things like that. So if you're talking and you got some bacteria and you're spitting on somebody that already has a compromised immune system, then you're increasing the risk of them. So knowing skin rashes, hives, things like that are all indicators of an allergic response. So treat accordingly to that. We assess for any swollen lymph nodes. So, we kind of touch under your neck, under your arms, in your growing, those things like that can indicate it. And it's just like little round, hard nodules that you will have, and they're normally really kind of small. You can feel that. But then, when you start kind of feeling them getting larger, or you feel more, like, okay, I don't always feel like one, because like right now, I can't really feel any. So then if I start feeling one, and okay, I know my body's doing its job. So my antigens, that's where they're starting to try to fight this infection. So we kind of go from there. Okay, physical inspection. So this is another thing that the nurse needs to be really mindful of. Taking your vital signs, knowing if an individual's blood pressure is low and the heart rate is high. Okay, we got something going on here, so paying attention to that. If they have an increased temperature, know that their heart rate is going to be high, because again, that's the body's inflammatory response. It's trying to fight off or kill this infection. But know that if it gets to be too much, that's not really good for the body as well. So you have to know when you need to start treating. And like I said, generally at 101, the physician a lot of times will start treating the temperature, trying to make sure that bring the heart rate down. You think of certain things that you can do. So cooling IV fluids, cooling towels, bathing in tepid water. You don't want to bathe with any cold water. You don't want to cool the body down too quick, because they can cause shivers, which can cause more issues to your patient. You want to measure height and weight. That just tells their nutritional level, like are they growing like they should, and that kind of gives an indication if they're able to fight off. And again, kind of keep in mind, some of these things alone don't mean anything, but it's together they actually mean something. Looking at the skin color, the turgor, the texture of their skin, any presence of any lesions on there, again, tells you if they're at increased risk for infections, hives, or rashes. If they responding to an infection, if it's thin, if there's cuts or abrasions on their skin, they're at increased risk for it. So that's where these things come into play. You look noticing any edema related to that, and we talked about sometimes with mobility injuries, so even athletic injuries, and so they're getting this increased edema. And so basically what you treat that, even with like activity edema related to muscle or overuse of that muscle, is rest and ice that area, because if you don't, you can still have damage to the tissue of the nerve lining with that. But the main thing is treating it. Anytime you recognize or notice those things, seeing them as abnormal and treat accordingly to that. Inspecting their eyes, their ears, so any redness, any drainage, any irritation, things like that. Exudate, again, you're going to be looking for any thick yellow, green, you're looking for order, things like that. Okay. We talked about palpating lymph nodes. Listen to their lung fields. You notice any wheezing to their lung field, so it's indicating that. Reviewing their lab work, so looking at their CBC, their complete blood count, looking at their WBCs, this is elevated, is their basophils elevated, monocytes elevated, like see what's going on with them. C-reactive protein or your SED rate are also up to other inflammatory markers that may be done that would indicate some inflammatory response. Know that sometimes you'll see also with allergy testing, they can get a skin test or scratch test. There's a video in the module for y'all to kind of review a little more related to that. But basically it's kind of, they get, skin test, one skin test you can do is with the TB skin test, and you get a little tuberculin syringe. You put about 0.1, I think is what it is, of the solution under the skin, just under the skin. It's a transdermal under the skin, and there's a blevel there. If that blevel stays and turns red and swells, then you know you've come in contact with someone. It's only saying that you have come in contact. It does not say that you have it. You've come in contact with someone who has TB. All right, so as far as like your scratch testing and your checking for allergens and things like that, so it's the allergen, they put it and do little pokes on your back to see if there's any redness or if the patient complains of any itching or swelling or anything like that. So they're looking for an inflammatory response to it, and if it is an inflammatory response to it, then you know that you have an allergy to this substance. Okay, so whether it's food or whether it's medication or like dust, pollen, things like that is generally what you're looking for. With that, now you also have a blood test where they can draw your blood and see if you have a reaction to some of these things. Here, laboratory tests, like I said again, you'll generally see if an individual is having an immune response related to if their CBC is, or their white blood cell count is elevated, or if it's decreased, remember, means that they have a weakened immune system, increased, and if it's really decreased, then you also look at sometimes cancer, especially if it's depleted, because it's in the bone marrow, is not being able to produce the white blood cell counts like it needs to, and high, then it's overproducing with this. So sometimes when you see these on two opposite end of the spectrum, then you're looking at something greater than just a natural cancer. But again, you still have to, as a nurse, protect them because they're at increased risk for infection. And again, like we've already talked about, then their immune response is not going to be different. I mean, it's not going to be the same. So they may need a stronger medication because they may not respond to the usual dose of medication. Okay, so with this at table 10.3, so I kind of highlighted that, but the only reason why, because I'm really big on you understanding the nursing implications. So to me, it's not enough for you to know, what this is, but I want you to know what you need to do about it, because that's actually what you're going to be doing. You're going to be doing the action related to it. Somebody else is going to be telling you what to do, but you need to recognize these signs and symptoms and what to do. So kind of reading over this and just kind of being prepared. With that, The other thing is just kind of being aware. Hemoglobin, so you know if hemoglobin and hematocrit are decreased, then it's indicating some bleeding. If it's elevated, then it's a hematological issue that will be addressed. Again, we've talked about white blood cell count. So the book says 5 to 10. Sometimes you'll see 4.5 related to that. But in any case, the lab will have your normal ranges. Okay. So just kind of keeping that in mind. But you're looking at around this. You do want to be aware of this 4.5 to 10. Okay, and something that's slightly out of these ranges is not in itself significant. Okay, but being aware of this 5 to 10,000. Okay, and here again we kind of go with, we talked about the neutrophils, eosinophils, and basophils. Eosinophils a lot of times, like I said, dealing with your allergies. So just kind of being aware of that. And that's all we're gonna do there. No, I'm gonna go over that. And you don't have to memorize any of this with the IgG, IgA, like I'm still on that slide. You don't have to memorize any of these. You just need to be familiar with, if I see this, I know it's dealing with allergies, okay? So it kind of helps you understand the question with that. And let's see. Okay, imaging testing, you're not really going to have to worry about that, but just know that sometimes they'll do imaging testing to make sure that there's no issue going on, or to assess for any issue, especially like the thalamus gland, which we're talking about is that your breastbone there that helps produce lymphocytes to fight infection. So they may look at things like that. Planning. So what are you going to do about that? We've kind of, this is just kind of going over it again, so I'm just kind of going briefly through this again. So it's protecting you from infection. The nurse's role is protecting. I'm not going to protect this individual. I'm going to talk to them and educate them beforehand. I'm going to put on my PPE, my gloves, my face mask. I'm not going to go to work if I'm sick. I'm going to tell them to limit company when they're sick. I'm improving health. We're going to educate again. We're going to talk about diet. We're going to decrease alcohol. We're going to decrease drug use. We're going to recognize signs and symptoms beforehand. Let's see. We're going to maintain a high degree of wellness. Exercise, again, diet, all these things kind of play hand in hand. So understanding that we're going to improve health status, we're going to give the medication, antibiotics like we're supposed to, or teach the patient to take the antibiotics like they're supposed to, and don't stop them even if they start feeling better. So making sure that we understand that. Again, like I said, when we talk about implications, your nursing interventions, standard precautions, so following your PPE, your hand washing, your gloves, your face mask, in and out of the room, not using the same equipment, especially when a patient is immune compromised. If you notice, a lot of times in the hospital, they have their own blood pressure cuff there. And if you're using the same blood pressure cuff like you see sometime in the nursing home, the key to that is making sure you clean your equipment after you use it. Make sure you know how to use cleaning materials, because if you read on the back of some of them, it talks about, how you're supposed to spray it on there, let it sit for a little bit, and then you wipe it off, because if you don't follow those steps, then you don't adequately kill the bacteria. So just understand that. Look on the back of a Lysol can. What does the Lysol can say in order to be effective? Matter of fact, I have a can of Lysol right here. And so just kind of reading on it, and let's see, directions. Hold this can upright 6 to 8 inches from surface. You spray 3 to 4 seconds until covered with mist. So that's how you're gonna To sanitize, surface must remain wet for 10 seconds, then allowed to dry. Disinfect surface may remain visibly wet for 3 minutes, then allowed to air dry. For hepatitis A virus and against other virus and stuff like that, the surface must remain visibly wet for 10 minutes, then allowed to air dry. Okay, so it's just not enough that you going through and you spraying like, oh, I'm killing all this bacteria, but understanding, what your chemicals that you're using, what the instructions say, to ensure that you're maintaining the person's health. teaching your patients that, because how many of y'all really realize that? Okay. Um, so just understanding that, promoting a balanced diet. So being, educating them. We talk about limiting. We don't always go and say you can't completely do this. When you go out to eat, think about some things that you can do. Think about some things that you can order. Think about some things that you can cook to still get that, fulfilling feeling, related to that. Teaching your CNAs and UAPs, recognizing when they're not using safe practices, okay, and educating them related to that. You want to decrease fear. Kind of the main thing when we're talking about changing their lifestyle, changes or whatever, because that stress, makes things worse. So a lot of times when people are educated on the disease or their diagnosis, that improves their self-care, that, decreases complications related to that, because they know, like, hey, my symptoms are getting worse, I know I need to go, into the doctor. So that allows the doctor to be able to treat the individual at the beginning stages versus, it's gotten too far away. Even with cancer, you have somebody that's increased risk for cancer. Like, hey, these are the warning signs of cancer: your change of weight, your anorexia, and it's different from anorexia nervosa. So anorexia is, a lack of appetite. So let's talk about, these things. We talk about what's expected. It's expected for you to have a temperature. It's expected for it to be a little red. Like it's expected for you to have a temperature right after surgery, because your body's doing its job. It's trying to fight. It's trying to heal, because we've just went in. We've made incisions and things like that. So the body's doing its job. That's okay for that to happen. Let's see. So just kind of monitoring those things, with that. Again, in 10.4, again, I kind of just highlighted, your nursing interventions. Kind of be familiar with some of these nursing interventions. I want you to read over them and kind of be familiar with them, just so you're understanding your role is maintain a patent airway, just like we give the immunizations. And if an individual has an allergic reaction to the, immunization, so understanding their airway is important. Administering that EpiPen. If you have someone, you're taking care of them with an airway or respiratory issue, monitoring, them at least every 2 to 4 hours. I'm going for the every 2 hours, just because things can change so quick. Give a supplemental oxygen as needed. Follow your facility protocol, because the physician can say, give 2 liters per nasal cannula. But then you notice that their oxygen level is continuing to drop, and like, okay, I need to give them something while I'm waiting for the physician to call me back. What does your facility protocol say? Can you go up to, 3 or 4 or 5? So being aware of that. Monitoring the temperature, especially if you have someone with an infection. They do not have an infection, and all of a sudden they get an infection. Did the infection go away, and then now their temperature has come back? Administering your antipyretic, so your Tylenol, your Motrin, whatever is indicated for this individual, their antibiotics, your cooling measures, taking their intake and output, so ensuring that their kidney, is functioning properly, because sometimes your antibiotics, you got to keep in mind, your antibiotics that you're giving these individuals can sometimes be nephrotoxic, so they can injure your kidneys. For certain diseases or infections can again damage, your kidney. So you need to be aware of that, just like some medications can damage your liver, as well. So I need to know when something is going wrong. Your intake and your output kind of is one of those indicators. If I've put in 1,500, but I've only gotten out, 60 mLs, and it's been, 5 hours, and you're supposed to put out 30 an hour, then you're lacking there. Something is going on. That's your first line, your first indication, that something is wrong. Okay. So watching for any rashes or hives, with your individual. So you give them an injection, you give them a medication. These again are indications that an individual, is having a reaction to that. Keeping the skin clean and dry, applying lotion to them, especially in the long-term care facility. Teaching your CNAs or UAPs, this. So if you notice that if you have an individual that is scratching a lot, because again, you remember our skin is our first line of defense. So you want to keep their nails short. You want to make sure you maybe put something over their hands, distraction. So something that's going to help them. Don't bathe in hot water, because that kind of causes irritation in the skin, as well. So I'm not going to go through all of these, but just kind of reading through that and being aware, knowing what they mean. If you have any questions related to what does this mean, then making sure you come in and ask me, so we can kind of discuss that. Let's see. Assessing readiness to learn. I am going to just mention just briefly about that. If the individual starts to ask questions, we talked about that last semester a little bit, but if an individual starts to ask questions about their diagnosis, then you know that they're ready to learn about it. If the individual kind of ignores it, they don't take the medication, they don't ask you questions about it, things like that, they're not ready. They're maybe not accepting the diagnosis for whatever reason. Okay, if you feel like you need help with it, you know to reach out to your social worker or your psych team to kind of help this individual deal with whatever this diagnosis is. Okay, but know that it's that when they start asking you questions or responding to you, kind of gives an indication that they're ready to learn. Pain management, kind of best thing, and rest and hydration. So keeping that in mind. All right, and let's see, again, the rise in the body temperature, where common problems related to the immune system or whatever. So knowing that the rise in the body temperature typically signals a normal immune system response. So we've already kind of talked about that. So understanding that's normal. It's helpful for the immune system. So you don't always want to try to stop things like that. But there is times when you need to stop it. So that 101. So physical or pharmaceutical measures, we've already kind of talked about those. So your cooling towels, your cooled IV fluids, things like that will help with that. You don't want to rapidly cool anybody. So we've talked about that. Identify the cause. Why is this individual sick, and address that antibiotic therapy. And then you're going to monitor, is this antibiotic effective for this individual, making sure they don't have any side effects. Sometimes they may need some corticosteroids, especially with a lot of respiratory type issues. But again, kind of keep in mind that sometimes those steroids can also decrease immunity. Related to that, your aspirin, your ibuprofen, your naproxen, or generally your medications used for that. A lot of times you'll see Tylenol. We don't give aspirin to children. Let's see, we've already talked about anorexia. I've already kind of mentioned that to you, just to decrease desire to eat. The only important is this, it's just kind of understanding sometimes that's natural for a person not to want to eat, but it's also kind of one of your first signs that an individual may be getting sick, like we talked about with the infants. With that, so you want to think about some things that the individual will want to eat, some cool foods, some popsicles, some things that are high in calories. Know that sometimes with fever, milk or dairy products can cause more irritation or GI upset, so kind of be careful with that. Monitoring their respirations and heart rates, and treating them, monitoring for hypotension and shock, so decreased blood pressure and increased heart rate. Those are some medical emergencies with that. And then so also with that, I want to bring one thing, and I won't stay on that a lot, but just so you understand too. So a lot of people look at hypotension just as being, oh, my blood pressure is below 90 over 60 or something like that, and that's just hypotension, so I'm waiting for the blood pressure to get to that. But also you have to understand these beginning stages of it. It's that drop in 30 points. So maybe their blood pressure was 140, over 70, and then now all of a sudden it is 100 and just 100 over 60, or something like that, or 100 over 50. It's that drastic drop, and their heart rate is elevated. So anything over 100 is considered tachycardic, or whatever. So understanding, even somebody, okay, yes, they may have a heart rate of over 100, 105, 110 or something like that, but when you get to 130, 140, and it's staying like that, no, there's a lot of work on the heart, and this individual is uncomfortable. So we need to talk about some treatments for this individual. Okay, so we talk about soups, ice chips, popsicles, clear juices, things like that are kind of some nursing management for individuals that have fevers. Small portions of food, so not large things. You don't even want to expect them to eat the whole thing. They just need to eat more of these smaller things that they can digest. Let's see, we've already talked about corticosteroids and how they can decrease it. Diabetes mellitus and chronic renal failure also can cause some immune response to be decreased with that. We continue to go through and talk about under nursing management how it's critical to follow all your standard infection control prevention properties. You taking your vaccines, you encouraging your patients to take their vaccines, hand washing PPEs, cleaning surfaces, cleaning your equipment, nails. We talk about making sure your nails are not really long, your hair is pulled up, things like that. Neutropenia. So the book kind of mentions that a little bit, and you'll see that, especially like in cancer patients, and they have Neupogen, which is a medication that they'll give to kind of help bring that up, because that has to do with your white blood cells, and they want to get your white blood cells up to where you can fight infections, because that's your body's natural response. It's the best way. Okay. Another big thing, especially with your patients that have severely weakened immune system, where their WBCs are really low. A lot of times is what you'll see with that, and then sometimes if it's really high, especially with certain patients with cancers, then you want to restriction on fresh fruits and vegetables. What are your fresh fruits and vegetables? Your oranges, your apples, things like that they just kind of put on the tray for you. You want to restrict those. Fresh vegetables. So your tomatoes and things like that, they don't need to have any of that canned foods, okay? Fresh flowers, so they want to bring something, no, you can't have those, because those things have bacteria that normally we're able to fight off, or they cause our immune responses that normally we're able to address, but these individuals cannot. Limit visitation from individuals, so very few individuals to come in to visit just altogether, whether they're sick or not, but just limit that altogether. And those that do come in to visit, they cannot be sick or can't even have been around somebody that's sick, because remember, we have this prodromal stage to where we're sick before we even realize that we're sick, or your body's starting to fight it off even before you realize it. So hand washing, put your face mask on, put your gown on even before you come in here, because we don't want you to bring anything off of your clothes to do that. Water purity, so I kind of mentioned that again, and making sure that the air they breathe is appropriate to them. All right, so I think that is all. So remember, if you have any questions, please reach out to me. I will be back in the class on Tuesday. Thank you all.